Hello, my friend. So
Hello, sir.
you were in San Diego
Yes,
last
I
weekend or 2
was.
weeks ago
I think
for
two
the
weeks
DNS
ago.
visceral course, right, with Dr.
Yes, it
Peter
was.
Bittner.
Yes, it was Viscero-Somatic patterns and relationships. It was very. It was an excellent course, as always. Peter does an excellent job, and it was precise, and the the organization of the teaching material was excellent. So it was went through systematic assessments, treatments of the organs, and also included tender points, head zones, and associated ribs and Chapman's points that were also associated with the organs, and they could be used to monitor treatment effectiveness. And yes, also a method of palpating that was more specific to organ palpation, visual palpation, and so on. So it's a really nice way. It again is a complementary aspect of how your gathering data helps you with the actual review of systems. And as you know, I've talked about we need to know what is the physical expression or somatic expression of visceral dysfunction, because that helps us with our diagnosis. It helps us to be multifaceted in our treatment approach and to give a much better, much more effective overall treatment and strategy. So that is, again, when you look at the kind of data you're collecting, looking at the systems of the body, the visual system is a large part of that. And so Peter gave a great overview of diagnostics, assessment, and then treatment therapies that were logical and easy to perform, not complicated, and then you could have a retest, and by that way you could then continue with your rehabilitation.
You know, I guess I mean, it might be surprising or not surprising, but Peter Bittner rarely has taught that course in the United States. And I mean, I've been taking courses since 2007 and never actually had the opportunity to get to the
Mm-hmm.
course. It's only been here a couple times and it never fit. I met him the couple times, not this last time in Prague. Actually, that's interesting to me now that I think about it. Peter wasn't there, last month in Prague, or at least he
Mm-hmm.
wasn't around the course, which he usually
Mm-hmm.
is.
Mm-hmm.
But I had, heard his lectures at the D course in Prague and seen just a little bit of practical application.
Mm-hmm.
But, could you, like a practical example of, I suspect this, I check this, the treatment looks like this, and then I go back and I check. What does that look like?
Let me see. Well, so for instance, if you were suspecting some gastric dysfunction, you would palpate the area of the stomach. You would look for the trigger point along the rib edge. You would look for a trigger point near the xiphoid process. You would have both the head zone trigger point, the kind of gastric trigger point itself, and the sensitivity of your palpation of the localized area. So the Chapman's point, the head zone, the other associated trigger point, the trigger point in the pec muscle. And using these 4 or 5 items, you would then proceed to treat the gastric dysfunction through release, through repositioning. If you needed to pull it down, you'd pull it down relative to the diaphragm. You would loosen the ligamentous contractures that might be affecting the stomach's function. And then you'd go back and check the results against these trigger points. And some of them you will also treat. They will not only be your monitor, but they will be treated eventually during the treatment. So this this multifaceted approach where you are aware of using indicators, some of which will be eventually treated, but they are not treated in isolation without knowing their relationship to the gastric dysfunction, is quite important. And that is always a little bit of a dilemma in rehabilitation, to not prematurely treat indicators in the erroneous supposition that you are now treating the main problem. Because if you treat the indicator and you don't treat the root cause, you are now leaving yourself open to floundering with no true indicator to help you know how effective your intervention would have been.
Yeah, I mean, it goes back to our integrative assessment model that all of those signs and symptoms that your patient either reports or that you find on a palpatory exam, a muscle strength exam, a range of motion exam, you just have to commit to the idea that you don't, those are all just pieces of data coming from the nervous system. And you cannot just go chasing these data points and treating them. You just can't do it. You're ruining your little scientific experiment that rules in and rules out things. You're just ruining the data.
That's
really.
right.
I mean,
you corrupt it, yes.
Yeah, corrupt it. That's exactly right.
You must assign this data by the evidence and the assessment to the different systems that may be involved, and rank them in order of likelihood that they are involved in the presentation. Yes. And I guess, by doing that...
Go ahead.
No, by doing that, then you have a logical sequence of testing or elimination as you go ahead to see am I really dealing with? Am I dealing with shoulder pain or liver problems? Am I dealing with stomach pain or a rib, or is this really a pec strain, and so on, ad nauseum.
Right. Going back specifically to Peter's course, you mentioned essentially, so there's the treatment aspect is a direct kind of myofascial manual treatment to the organ, some type of visceral mobilization, some type of fascial mobilization, and then direct kind of trigger point treatment as well. Anything magical about his version of these things? I mean, his direct trigger point treatment, is he just rubbing the hell out of a trigger point?
No, I think that what was interesting was that he had 3 levels of intensity in treating the trigger point. Pressure that was really to treat the actual somatic presentation.
And he call it the first level is the Martina level, the second level is the Robert Lardner level, the third is the Pavel Kolaj level that sends you right to the moon. Is that the check pressure level. Because I remember them telling me, "Oh yes, the pressure's very light, very not painful at all." And then Kolash comes over and jams his thumb through your sacrum, and then it's all over at that point. You have to leave the course, so you understand the levels of.
I know the levels can be malleable, but he did have three. One was a kind of emotional barrier, one very light, which speaks to calming down the sympathetic parasympathetic freeze function or dysfunction. And then there was the mechanical barrier, the fascial barrier, and then a more deeper mechanical barrier that would help you to actually move or stretch or reposition. So he had these three levels. I may have misnamed them, but there were three. And so rather than just press down on a trigger point, depending on what you were going to do, you would back off and try to treat it not only with high pressure, but also with moderate or very mild pressure, which was really a kind of emotional treatment. Just like you would rub somebody's shoulder if they were upset, or you would touch their hand. That kind of treatment is often forgotten. It is so light and so goes so unnoticed in social circles that we do not see it as an effective treatment in its own right. But
if you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.